Imagine dedicating your life to caring for others, fighting one of the toughest diseases out there, day after day. But what we often don't see is the quiet, the emotional toll this takes on the people actually providing that care. Today, we're taking a deep dive into exactly that, the really critical burden carried by healthcare personnel working in oncology clinics. Our mission here is to explore the findings of a specific study. It's called Burnout Status of Healthcare Personnel Working in Oncology and Their Coping Methods. It was published back in HealthMED in January 2011. Think of this deep dive as your shortcut to understanding the complex realities these professionals face. We want to move beyond just the surface level to what's really going on.
Right, and the study is important because it gives us actual quantitative data on something often overlooked and helps us understand not just what burnout is in this specific challenging setting, but also who seems to be most affected and, crucially, how they're trying to cope with it all. It really sets the stage.
Okay, so let's start with burnout itself. How does this study actually define it in this healthcare context? What are we talking about?
Well, they use a definition from Maslach and Jackson, which is quite powerful. They define it as the index of the discrepancy between what human beings are and what they have to do.
Hmm.
And to measure this, they use the Maslach Burnout Inventory, the MBI. It looks at three core dimensions. First, there's emotional exhaustion, or EE. That's described as a depletion of emotional sources, basically feeling drained. Second is depersonalization, or D. This involves developing a sort of negative, almost unserious attitude towards the people they're caring for, a kind of detachment. And the third is lack of personal accomplishment, LPA. That's the tendency for someone to evaluate themselves negatively, feeling inadequate in their job.
Wow, you can almost feel the weight in those definitions.
Yeah.
And then you think about oncology specifically. This source points out some unique challenges, doesn't it? Things like the sheer severity of the patient's conditions.
Exactly.
The rising expectations from patients, dealing with the death of patients frequently, that feeling of helplessness, and what the study terms the emotional tangle of just constantly being exposed to suffering.
And that really highlights why this context is so incredibly demanding. The emotional aspect is just relentless. These professionals aren't just treating a disease. They're face-to-face with profound human suffering and loss, day in, day out. It can absolutely, as the study says, deplete both professional and personal sources. It's more than a job. It's this constant emotional output that can feel, well, overwhelmingly draining.
So after painting that picture, the big question is, how common is this? How prevalent is burnout among these oncology caregivers? The study surveyed 444 people, 137 physicians, 290 nurses, 11 social workers, and 6 psychologists. What did the overall scores show?
Right, so looking at the overall MBI scores, and these are on a 0 to 4 scale, for emotional exhaustion, the mean score was 1.76. For depersonalization, it was 1.05, and for lack of personal accomplishment, it was 2.25. Now, what these numbers tell us, essentially, is that healthcare personnel in these oncology settings experience a moderate level of burnout. And this actually lines up with other research mentioned in the paper. One study found a 44% burnout rate. Another reported 56% of oncologists burning out, with over half attributing it directly to working with fatal diseases.
Okay, moderate level. Given everything we just discussed about the intensity of oncology work, you might almost expect it to be severe. So the studies sound moderate. What do we make of that? Is moderate still a major red flag? Or does it suggest maybe some surprising resilience?
That's a really crucial point. Because moderate might sound better than severe, but it absolutely still represents a significant issue, a real burden. The study itself suggests that maybe this moderate level, instead of something higher, could be down to things like the personal characteristics of the staff, their individual coping skills, maybe even positive feedback they get from patients. It kind of hints at the immense personal strength needed for this work, but yeah, it definitely doesn't make the burnout disappear. It's still there.
Okay, let's dig into that a bit more. Who is most vulnerable? Did the study find differences between the professions? Like, are nurses experiencing it differently than doctors?
Yes, absolutely. There were clear patterns based on profession. Nurses, for example, showed a higher risk for emotional exhaustion. Their average EE score was 1.80, the highest among the groups. So they reported feeling the most emotionally depleted. Physicians, on the other hand, they were at higher risk for depersonalization. Their D score was highest at 1.24, suggesting more of that detachment in patient interactions. And interestingly, with psychologists, they showed a higher risk for lack of personal accomplishment. Their average LPA score was 2.04. Now, this scale is a bit tricky. A lower score here actually means a greater sense of lack of accomplishment or inadequacy.
Ah, okay, that's important to clarify. So lower score means feeling less accomplished.
Exactly.
So beyond the specific roles, what about the work environment itself? Did the study identify factors like workload or pay as major drivers?
Oh, definitely. Two big factors stood out. First, excessive workload. The study really stresses this. It was a significant variable for all three dimensions, EED and LPA. And get this, a huge 77% of the people surveyed felt their workload was just too much.
Wow, 77%.
Yeah. And the second factor was wage perception. Around 73% felt their income was inadequate. And those who felt their pay was inadequate, they were at significantly higher risk for emotional exhaustion. Which makes sense, right? Feeling undervalued can really contribute to that burnout, potentially leading to what the study called discontented, careless, and insensible care.
That link between feeling valued and the quality of care is so important.
Hmm.
Okay, so the job itself creates huge pressure. What about wider factors like demographics? Did things like gender, age, or education level matter?
They did, yes. Regarding gender, women showed a higher risk for emotional exhaustion and lack of personal accomplishment. This was especially true for nurses. The study suggests this might be linked to responsibilities related to their homes and children, that dual burden. Men, interestingly, showed a slightly worse picture regarding depersonalization.
Hmm.
And education level was a bit counterintuitive. Higher education levels were actually associated with increased depersonalization and lack of personal accomplishment.
Really, higher education led to more burnout.
In those specific dimensions, yeah. The study speculates it might be due to higher expectations placed on them, or maybe the nature of more specialized roles where the direct patient impact feels, I don't know, less immediate, leading to that dissatisfaction.
That's fascinating. And what about age or how long someone's been working in the field? Does experience help buffer against burnout?
It seems like it might. The study found a strong negative correlation with age. Basically, as age went up, the scores for EED and LPA tended to go down. Seniority, or time in the job, also showed a weak negative relationship. So yeah, it suggests that accumulating experience might help people develop better coping strategies over time. The average age in the study group was about 35, almost 36.
Okay, interesting. And marital status, did that play a role?
That one was found not to make a statistically significant difference overall, though they did note that widowed or divorced individuals showed slightly higher EED and a bit lower LPA, meaning more lack of accomplishment, but it wasn't a major differentiator across the whole group.
Right. So we see all these factors swirling around contributing to burnout. But what's the actual tangible impact? What did the study find about the physical and mental health consequences for these professionals?
Yeah, this is where it gets quite concerning because it's not just a mental thing, it manifests physically. The study found the top 3 reported health problems were headaches, that was almost 22%,
Whoa.
sleep disorders, over 19%, and then stomach issues like ulcers or gastritis, almost 17%. So significant percentages suffering from these.
It's not just feeling stressed, that's real physical illness.
Exactly. And it didn't stop there. Other issues reported included things like excessive nervousness, constipation, allergic reactions, even hypertension. They even broke down some issues by profession. Physicians mentioned things like hair loss, anxiety, backache, fibromyalgia. Nurses reported problems like getting frequent infections, depression, asthma, hearing loss, even varicose veins.
It's a really sobering list. It highlights the immense strain they're under. Faced with all that pressure, people naturally try to cope. What did the study find? How are these healthcare workers managing?
Well, the most frequently used coping mechanism, according to the study, was searching for social support. It had an average score of 2.04 on a 0 to 3 scale used for coping strategies. And this is actually seen as a really positive finding. It suggests that, by and large, these professionals are using healthy, active ways to cope. They're, as the study puts it, taking steps to cope with burnout in a right manner. This shows resilience. Encouragingly, the least used method was the submissive approach, just kind of giving into it.
That resilience is definitely powerful.
Yeah.
But there's a bit of a contradiction, isn't there? Because the study also concludes that it was not possible to avoid burnout in oncology clinics altogether.
Right.
So if it can't be completely avoided, even with good coping, what's the solution? What can be done systemically, maybe by administrators?
This is really where the study's recommendations for action come in, and they're quite direct. They state very clearly that administrators should rapidly put into effect projects or regulations which may protect personnel from burnout. It's a call to action. And they list concrete steps, things like reducing patient density, basically, workload,
Makes sense.
increasing the quality and quantity of staff, raising wage levels, addressing that inadequacy issue,
Yep.
improving general working conditions, making job descriptions really clear and precise, setting up regular team meetings for support and communication, providing ongoing training, increasing chances for promotion, making sure there's fair rotation for tough shifts or tasks, and crucially, respecting break times.
That's a comprehensive list. And it sounds like these aren't just nice-to-haves for the staff's sake, right? The study suggests these have broader benefits.
Exactly. The study emphasizes these steps aren't only about individual well-being, though that's critical. They're also expected to increase the motivation in the workplace. And increased motivation, better well-being. That naturally leads to better teamwork, better focus, and ultimately, better patient care. It's all connected.
So let's try and wrap up our deep dive for today. The key takeaway seems to be that burnout in oncology is it's a really significant and complex problem. It's shaped by the intense nature of the work, workload, pay, even demographics. And this is important, the study shows it's not inevitable. It can be prevented or at least managed with the right strategies from individuals and, crucially, from the organizations they work for.
Absolutely. And if you look at the bigger picture, it really boils down to acknowledging the huge emotional and physical demands we place on these essential workers. We have to recognize that their well-being isn't separate from the care they provide. It directly impacts it. We rely on their skill and compassion, and they need our support and systems that protect them.
That leads to a final thought for you, our listener. Given what we've learned today from this study, what responsibility do we have? As a society, perhaps, how do we ensure that the people caring for the most vulnerable among us are themselves properly supported and shielded from burnout? Are there specific, tangible changes you could advocate for, maybe in your own community's healthcare system? Something to think about. We encourage you to continue your own deep dive, maybe looking into how healthcare policies affect these vital frontline professionals.